So Panu Rantakokko will come and present next. So Panu is a senior researcher at the Finnish Institute for Health and Welfare, or THL, where his work focuses on the environmental chemical exposures and their connections to chronic diseases.
Okay, so it's environmental chemical exposures, and I focus on PFAS because, of course, the chemical universe, as we call it, is far too broad to be treated in any single presentation, and even the PFAS is very, very broad. And I named it the sticky and slippery exposure challenge, and I speak something about the burden of immune-mediated diseases. And actually, the sticky and slippery both apply to PFAS. The sticky is one compound, and slippery, if you put the compounds together, you make a material out of it, like Teflon. But like a single strain of Teflon or polyfluorotetraene molecule is quite sticky actually, but when you put those together, it becomes very slippery. So it's quite paradoxic material, but there are reasons or ways to explain how it behaves. Okay, so this is quite bold statement, but my personal view that like the way we arrange this current stakeholder meeting via Teams would not be possible today without PFAS. Because, for example, in the electronics, at least during the last decades, the role of PFAS in the development or making of electronics and chips is quite critical. And I would say that for now and maybe for some future years before the developments come about, we would not have this advanced technology for society as we have today, including this presentation. During the last 15 years, we can say maybe since 2010 or something, the number of health-related PFAS studies has really gone up. As you see the green line, and it stops at 2020, and I think the upsticking of this green line is similar during the last 5 years also. So really the number of applications is huge. And the childhood immune disruptor role of PFAS is one quite important research field as regards to PFAS, and that's something I speak more about in this presentation. So if we see how the two things have developed, so if we take first the 2012 landmark paper of Grandjean, which was speaking about the reduction in the vaccine response among children from faraway islands. It was published in summer 2012, and how this ongoing development in the immune impacts of PFAS has impacted the EFSA risk assessments. The changes have been quite dramatic. And then we can also at the same time look how the definitions of PFAS has changed the number of potential PFAS compounds that are emerging in the legislation. So 2008, the log scale on the left side, the tolerable daily intake was 10,000 times higher than it's today for P4 and about 1,000 times higher for PFOS compared to today. So it has really gone quite dramatically down. And really at the same time, we can maybe say that the number of PFAS compounds that were by any means considered 17 years ago was few hundreds. It was maybe known that, well, there are maybe more, but like the estimate was something like that. By 2018, the OECD definition was speaking mainly about something like 5,000 compounds. And then when the OECD definition of 2021 came about, so we can currently say several million PFAS. So it's about the definition and about the health research. And those give quite varying trends in terms of how we should understand the PFAS contamination, which makes the human definitions and then relatively well-defined health effects make this thing quite complicated. Okay, at the same time, there are some restrictions on very few PFAS at the moment compared to the total number, which started to take place around 2000 from voluntary industry restrictions. And as a result, we see that this is from Sweden, the data on the left side panels, that the exposure to PFAS, PFOS, and then PFNA and PFHHS, which are so-called EFSA-4 PFAS, have gone down quite importantly, or remain stable like for PFNA, and I think the PFNA exposure is also going down during the last, say, 5-7 years. And then at the same time, maybe those who have been in the type 1 diabetes research know that like in the past years, it was always increasing, but like since 2005 or something, the incidence of type 1 diabetes has gone down a little bit surprisingly, or at least it's stabilizing, but seems to be going down among the younger age groups. Of course, there are a number of reasons like the vitamin D supplementation in some types of foods, etc., that may be also behind this trend. But then there's, of course, the research interest that if the exposure to these well-known immune disruptors is going down, would that be one of the reasons for the decrease in type 1 diabetes incidence? In HEDIMED, we approached these questions through two cohorts. One was DIP in Finland, and the other one was MOBA for Norway. And we had slightly different sampling and also the time scale of sampling. In DIP, we took serum samples at 6 months of age, and MOBA, we had cord plasma, slightly less than 1,000 samples from each cohort, but then sampling years. So from DIP, we took 95 to 2004 as a high exposure period, so before like any restrictions effectively took place. And then after the restrictions already had an impact on the exposure was 2010 to 2019 time periods. We call this low exposure period. And then for MOBA, we were like in between years when the restrictions started to take place. So we can say that the exposures were stable or declining depending on the compound. And the outcomes were type 1 diabetes or the autoantibodies and celiac disease in both cases. And we had matched case control setting, and then the PFAS levels and disease associations was in the focus. And we have also some further exposomic studies going on, or lipidomic studies together with University of Örebro, where we also see how if the PFAS are affecting lipidome and via lipidome, the T1 diabetes incidence, so meaning more like indirect mechanistic approach, which will also be, it's currently in the pipeline, so the results are not ready from there, but we are planning or starting the analysis also on that sector of the research within HEDIMED. Okay, generally we at the moment have mainly trends. So if we consider the levels in DIP, the high exposure period, we can see that the levels were like somewhere between 10 and 20 nanograms per milliliter in both case and controls. And then when we go to the later period, then 10 years later, the last decade, then the exposure have gone to somewhere around 5 or less. And in the serum of 6 months year-old children. And EFSA set a critical serum level of 17.5 nanograms per milliliter for children at 1 year of age. And we can say that in the later time period, we are clearly below this critical level where the immune response after vaccination should be very limited. So in this sense, the setup was quite good that if there is an effect, meaning that if the EFSA critical level is real, then we could see an effect in the early years, and then we would be less likely to see an effect in the later years. But as you can see from the bars, at least in the very raw analysis, there was no difference in the levels between cases and controls. So this is very, very raw results. So like no effect at the moment. but then we are going to refine the analysis and see if there are some background variables, including the lipidome, that might mediate effect, at least in some part of the population, in indirect way. And in MOBA, we are currently analyzing only the trends. This is the only result that we have at the moment. And there you can also very clearly see that the levels are decreasing during the first decade of this millennia. And what we can say also that with the cord blood, there is no critical level for 1-year-olds. It's the 17.5, which is the higher straight line. And then for mothers who bring on their exposure in utero and also through lactation, EFSA was setting level of 6.9 nanograms per milliliter, but both of those are not very directly applicable to the cord blood serum levels. So we cannot say it's maybe somewhere in between, and we can see as in the DIP cohort that levels are declining, and most likely by 2010 and certainly by today, those would be below. If there is some critical cord level, that would be below today. But also the further testing regarding PFAS are still upcoming. So the analysis were finished quite recently, the chemical analysis of the PFAS in serum. Okay, the policy relevance. So we see from the results very clearly that the PFAS we selected for the project have been very effectively reduced and are currently largely below the EFSA critical immunotoxic threshold, and restrictions have been taken place by voluntary company actions since early 2000, and this concerns PFOS and PFOA. And then they widened in EU through the so-called POP regulation, which was banning some of the PFAS, PFOS and PFOA in particular, and then also through REACH regulation. And I would expect that I think many of you know that there is currently a very large 5-member state restriction proposal in treatment in ECHA. It was submitted 2 years ago, but it is very, very broad restriction proposal, and has proven to be quite difficult to treat it in the timeline that was originally planned, and it's still ongoing. But it's already very clearly seen that the proposal is working indirectly by giving the companies incentive to find PFAS alternatives before the actual compounds that they use are being restricted. So this is an example of effective restriction indirectly before it's actually implemented. And okay, the practical recommendation, this HEDIMED has been very good cooperation between clinicians and environmental chemists, and it continues. And currently what I understand is that the PFAS-containing materials that are most relevant for exposure and health effect in the long term is a very important and also quite difficult, because we have plenty of PFAS-containing materials around us, and they are slowly releasing PFAS to the environment, and finding the most important sources of this release and also the end products that they release to the environment is, per se, a very important research theme at the moment. And for this reason, the exposure and toxicity of a large number of PFAS remains to be discovered. So we can say that the most well-known PFAS have been quite well treated and exposures are decreasing, but that's only the so well-known tip of the iceberg that we have treated up now. So a lot of work regarding PFAS remains to be done. And what's next in HEDIMED? So we have the statistics and the lipidomics incorporation, and publication has started. And then we also have to combine the PFAS results with the wider microbiology and molecular biology exposomic landscape. And then we also have to expand the collaboration. I would say also the material science is something quite important, or the material monitoring science. And one which I would especially mention is the green transition and the other big drivers where PFAS alternatives are quite challenging to find, and indeed necessitates vigilance on behalf of the exposure science. And so there seem to be quite contradictory drivers going on, and how to balance these is something to have a look upon. That's all from me. Thank you.